Hey there. Diving into this whole thing about medication-assisted treatment, MAT for short, it's been pretty eye-opening, even for me.
Yeah.
And you sent over some really compelling stuff, really gets you thinking about how we see addiction and recovery.
hmm
One story that really stuck with me, there was this woman who talked about MAT as like getting her life back on track.
Yeah.
She was saying how the medication really helped with those intense cravings, the ones just totally consuming her.
Yeah. Yeah.
And it let her actually like focus on therapy and start dealing with the root causes of her addiction.
Right.
And it just like hit me how powerful this whole approach can be when it's done right, of course.
Yeah. And what's so fascinating here is how Matt really tackles addiction on these multiple levels, right? Which is key because, as we know, addiction, it's not just a physical thing, right? It's this whole interplay of biological, psychological, and social factors all tangled up.
So it's like we can't just slap a Band-Aid on the symptoms. We got to look at the whole picture, right?
Exactly. That's where the holistic approach with AMPAC comes in.
Yeah.
This combo of FDA-approved medications and therapy working together.
Okay, so we're not just talking about swapping one thing for another here.
Right, right. And I think it's important to be super clear about what MAT is not. It's not just replacing one substance with another. It's about using these meds strategically alongside therapy to help someone regain control. It's about empowering them, you
Yeah.
know?
Which makes sense, because if your brain's always stuck on those cravings, it's going to be really tough to focus on anything else, let alone making real changes,
Yeah.
Like even before this deep dive, I used to think addiction was all about willpower. Right?
Yeah.
But then reading through the stuff you sent about how these substances hijack the brain's reward system,
Yeah.
man, that really shifted my perspective.
Right.
It's like knowing that how can we judge someone for struggling to break free?
And that's the thing. It's a huge misconception. There's this stigma around addiction, right? This idea that it's a choice, not a disease. But when we get that, addiction actually messes with your brain chemistry.
Yeah.
It's obvious we need a more well-rounded approach to treatment, just like a MAD.
Okay, so we've talked about the why behind MAD, but how about the how? What's actually going on in the brain when someone's using medication as part of their treatment?
So it all comes down to understanding how these medications interact with these things called receptors in the brain. Let's take, say, opioid use disorder as an example. Medications like methadone and buprenorphine, they're what we call opioid agonists.
Opioid agonists, meaning, sorry, just want to make sure everyone's on the same page here.
Of course. So an agonist. Basically, it activates a receptor in the brain. It's like mimicking the effects of a natural substance, or, in the case of addiction, the substance that's being misused.
Okay.
Now, here's the key difference. Methadone and buprenorphine, they activate those opioid receptors, but way less intensely than, say, heroin or fentanyl would.
Okay, so it's like turning down the volume on those cravings, letting someone function without being totally overwhelmed.
Exactly. They work by binding to those same opioid receptors, but they reduce cravings and withdrawal symptoms without that huge euphoric effect.
Which frees them up to actually engage in therapy
Right.
and work on all the underlying stuff that's contributing to their addiction. Because, like we said, it's not just about stopping the substance use, it's about the whole person.
Exactly. Now, on the flip side, we have naltrexone, which works as an opioid antagonist.
The antagonist.
So think of an antagonist as blocking the receptor, kind of like a closed sign,
I
right?
got it.
So if someone on naltrexone were to relapse, use an opioid, they wouldn't get that euphoric rush. No reward, which kind of breaks that cycle of addiction.
Wow, that's really interesting. So you're removing the incentive to use in the first place.
Right.
Okay, so that's opioids. But what about something like alcohol addiction? How's MAT used there?
Well, with alcohol use disorder, we've got a few options. One is actually naltrexone, which, like I said, also works on receptors involved with alcohol, not just opioids.
Ah, okay.
And then there's disulfiram. You might know it as antabuse.
Oh, yeah, antabuse. Yeah, I remember reading about that.
Now, this one's a bit different.
It's not about reducing cravings, right? It's more like
No.
aversion therapy.
Yeah, you could say that. Disulfiram messes with how your body breaks down alcohol, so if someone drinks while on it, not a fun time. We're talking nausea, vomiting, headache. Really unpleasant.
Yeah, definitely a strong deterrent.
It can be really effective, especially for those who are set on avoiding alcohol, like really committed to their recovery.
It sounds like having that drive, that intrinsic motivation, is super important for any of these medications to actually work.
100%. Medication, it's a tool, right? Not a magic wand. It's about working with a healthcare pro to figure out the right medication, if any, and using it with therapy, with support, to get at those root causes of addiction.
And speaking of different options, there's this part in the materials you sent about off-label uses in MAT. Got me curious, I gotta admit. What's that all about?
Yeah, off-label, it does sound kind of sketchy, doesn't it? But honestly, it's more common than you'd think. Basically, it just means a doc's using a medication for something other than what the FDA specifically approved it for. But, and this is important, it always needs to be done carefully. By a doctor, I mean,
So it's not like they're just, like, experimenting on
yeah,
people, right? There's a reason for it.
totally. There are actually really good reasons to think about off-label uses in MAT, like the stuff you sent mentioned anticonvulsants, topiramate, gabapentin, those kinds of things.
Oh, right. Yeah, I remember that.
So
Those are for seizures usually, right?
exactly. But some research is saying they might help with alcohol use disorder too. It's not like what
Mm.
they're made for, but it seems like they could help reduce cravings, help people cut back on drinking.
Huh. That's interesting. I guess it just goes to show how much we're always learning about the brain, about addiction.
For sure. What works for one person might not work for another at all, and what we thought we knew about a med it can totally change as we do more research.
Right.
That's why it's so important to use evidence-based practices. We don't want to just be throwing medications at the problem. We want to use treatments that, actually have some science behind them.
Which is what you were saying before with Matt being evidence-based.
hmm
What kind of evidence are we talking about here? Like, what makes this approach different from someone just quitting cold turkey?
Well, first off, tons of studies have shown that MAT is way more effective than a placebo when it comes to preventing relapse. And that's for both opioid and alcohol use disorder, by the way. For example, SAMHSA, they're the Substance Abuse and Mental Health Services Administration.
Okay, yeah.
They point to all this research showing how people using MAT, they stay in treatment longer, which is huge. That's often what it takes to recover long term.
Yeah, that makes sense. If the treatment helps with those cravings, the withdrawal, it makes sense that someone would be more likely to stick with it.
Exactly. And for opioid use disorder in particular, the evidence is really strong. Studies are showing that MAT is linked to a big decrease in overdose deaths.
So it's not just about, like, quality of life. It could actually save someone's life.
Absolutely. But I do want to be clear, just like any area of medicine, there are definitely gaps in what we know. The research isn't perfect. Which, by the way, I thought the material you sent was really upfront about that, so kudos to them.
Yeah. Well, science is always a work in progress, right?
Exactly. So, for example, even though we're seeing more and more evidence that MAT can be used for stimulants.
Stimulants. So, like, cocaine, meth.
Yeah, exactly. But it's not as widely studied for those as it is for opioids or alcohol.
So we still need more research to figure out the best way to use it for those kinds of substances.
Exactly. But even with those gaps, the research we do have shows that MAT is very effective for treating addiction.
Okay, so switching gears a bit, let's talk about something that I know is a big concern for a lot of people when it comes to, well, healthcare in general, cost. We've talked about how beneficial MAT can be, but how accessible is it really? Like, if someone's listening to this and thinking, this sounds like something I need, what are they looking at cost-wise?
That's the million-dollar question, right? And unfortunately, it's not exactly a straightforward answer. There's no one price tag for MAT.
Because it's not like a one-size-fits-all thing.
Exactly. Cost depends on a bunch of things, like what medication you're using, the dosage, how often you need to go to the clinic, the kind of therapy you're doing, and on top of all that, it even depends on where you live and your insurance.
So there's a lot of factors involved. But are there any general ranges we can talk about, just to give listeners a ballpark idea?
I can give you some averages, yeah. So looking at the national average, methadone treatment tends to be the most affordable. It averages around $125 per week. Keep in mind that usually covers the medication and therapy sessions, so that's a good deal.
Yeah, that's a package deal.
For sure. Buprenorphine, though, that one's usually a bit pricier, typically between $100 to $150 each week. And then there's naltrexone, that one can get up there in cost. Could be upwards of $1,200 each month, especially the injectable kind, the extended release.
Wow, that's a pretty big difference. No wonder people are confused about the cost.
It's true. And then, of course, there's insurance, which just adds another layer of complexity. Every plan is different.
It's like you need a degree just to understand your insurance benefits.
I know, right? But on a brighter note, ever since the Affordable Care Act, more insurance plans have to cover treatment for substance use disorders, and that includes MN.
Oh, good.
And then we've got the Mental Health Parity and Addiction Equity Act, which basically says that coverage for substance use disorders has to be similar to coverage for other medical stuff.
That's a huge win, at least on paper. But I'm guessing it doesn't always work out that way in real life, does it?
Sadly, no. Even though those laws have made things better, there are still problems with coverage. Some plans cover certain medications but not others, or they might only cover a certain dose, or they might limit how long you can get treatment.
Sounds like a lot of hoops to jump through.
Yeah, it can be tough. And that's why it's so important to advocate for yourself. Don't be afraid to call up your insurance company, ask them about your plan, and if they deny you, you can appeal it. There are resources out there too. Sam HS has a website with tons of info on navigating insurance for substance use disorder treatment.
It really makes you think about how we could be doing things differently, as a society. How can we make this kind of treatment more accessible for everyone who needs it?
100%.
Yeah.
It shouldn't be this hard for someone to get the help they need. But let's not forget about that other important part of it we talked about earlier, the support system. It's not just about the meds themselves, right?
Totally. And this is what I find so interesting. The materials you sent, they talked about how everyone's recovery journey is different. Some people, they connect with those 12-step programs like AA or NA.
Right.
While others, they might find something like Smart Recovery or secular organizations for sobriety, those kinds of things, to be more their style.
Exactly. And it makes sense. When you really think about it, addiction, it doesn't discriminate, right? It affects people from all walks of life with different experiences, different beliefs, different needs when it comes to support. There's no one right way to recover, just like there's no one right way to approach Matt.
So how does someone even begin to figure out what kind of support is right for them? It seems like that could be pretty overwhelming in itself.
Yeah, it can be a journey. You got to explore, try things out, see what feels right. It's about asking yourself questions like, what do I value? What kind of environment feels safe for me, where I feel supported? What helps me feel connected? Like, people really get me, you know?
And to me, that's what makes this whole conversation about Matt so important, right? It's not just about replacing one thing for another. It's about creating that space for someone to heal, but on their own terms. The medication, it can help in the beginning with the cravings and all that, but it's the therapy, the support groups, that real human connection. That's what allows someone to actually thrive in recovery, not just survive it.
I couldn't agree more. And it really challenges us to rethink how we see recovery in the first place. It's not just about abstaining. It's about taking back your life, rebuilding your relationships, finding your purpose again. It's a whole process.
So as we're wrapping up our deep dive into MAP, what are some of the key takeaways you hope our listeners will remember?
Well, number one, addiction is treatable. It's a medical condition, not a character flaw. And MAT is a valid approach. It's backed by science, and it helps people get their lives back on track.
It's about meeting people where they are, with compassion, with understanding, and giving them the tools to navigate all the ups and downs of recovery.
Absolutely. Recovery isn't always a straight line. There are going to be bumps in the road, but with the right support, with commitment, lasting change, it is possible.
This has been a truly insightful conversation. So to everyone listening, if anything we've talked about today resonated with you, please go out there and get more information. Talk to your doctor, explore those resources online, and whatever you do, don't give up hope.
Yeah, for sure. Recovery is out there, and you don't have to do it alone.
Beautifully said. And to all of you listening, as you continue learning about this, we'll leave you with this thought. What does a truly supportive, compassionate approach to addiction and recovery actually look like to you? And how can we as individuals and communities create a world where everyone has the chance to heal and thrive? Until next time, keep those brains buzzing.